So we talked about the benefits of obtaining your genome sequence. Now I'd like to, for the end of this presentation, switch my focus to what are your valuable steps that you can take once you actually have your genetic sequence at hand. And I would like to preface that with the idea of how we actually perceive our risk of having a disease. So when it comes to specific disease, there's a variety of different factors that might influence how much we think we are likely to obtain that type of a disease. And many of these factors mm, are non-genetic. They are lifestyle factors. They are based in environment we live in. So they don't weigh too much on our idea of obtaining a specific disease, with exception of one specific item, and that is our family history. And our family history is by far the major contributing factor to what degree we think we will develop a specific disease. And typically, we dramatically overestimate that risk. This is not good because that usually will increase our level of anxiety, and sometimes it can even lead to inappropriate medical action, such as taking unnecessary medications or even doing unnecessary procedure. But if you don't have a particular disease running in your family, what about all the other health problems that you might have? And typically, we dramatically underestimate these. And this happens for a couple psychological reasons. Number one, it's information avoidance, and number two, it's optimistic bias. And the reason why we do that is because we don't like to think about our mortality. So we sweep that information under a rug and we just avoid it. So the reason why we do that is so that we can reduce our anxiety, but obviously this is not very useful to us. It's not very helpful to ignore information that actually might negatively influence your health down the road. So when we end up sequencing ourselves, typically what we find out is that the risk related to that specific family disease was overestimated and it's lower than we anticipated for ourselves. And that's good because then we don't have to worry about that so much. On the other hand, when it comes to all the other potential health threats to you, when we underestimate those threats, when you sequence yourself, you might find out that you have actually increased risk of developing certain diseases that you might not even be aware of. And obviously, the goal is here not to increase your anxiety. And finally, this brings me to the real reason why we should be sequencing our genomes. And the final goal is to actually change your particular behavior. So what do I mean by behavior change? Number one is to actually become more active, to exercise more. Number two is to eat proper diet. And everyone knows that these two lifestyle changes are beneficial to you. You don't need a doctor or to sequence your genome to know that. However, there definitely is an evidence showing that certain fragments of population, when they do receive DNA sequence information, they are more likely to change these lifestyle factors for the benefit. And those two factors are very important in being able to some degree overcome your genetics. So there are studies showing that if you do exercise and eat properly, then whether you are in a pool of negative genetics or good genetics, you are still very likely to improve your health outcomes in the future. So you can use these two lifestyle changes to cheat genetics to some degree. Obviously, number three is to change your medical management. If you do find out you have certain problems related to your DNA mutations, it might require medical management change. That's actually very highly likely if you sequence your genome. It's likely to happen in 1 in one in five individuals. And the final one is the one that actually might surprise you the most, and that is actually to look into insurance and protect yourself with insurance. And why is that important? And before we answer that question, I want to remind the audience that actually Canada passed a law that completely protects your genetic information. Canada passed this law in 2017. It's called Bill S-201. And basically, it means that no institution or no person can require your genetic information in order to provide you with any product or service. And that includes insurance companies. That means you can completely sequence yourself, and no employer, no insurance company will ever be able to have access to your information as long as this law is in place. So you are absolutely protected from genetic discrimination. It's really good that we have this law in place. So having said that, now let's continue how we can use that to our advantage. So when you sequence yourself, you have to face the very real possibility of detecting a disease, and that actually might have negative outcomes for your health down the road, to a point that it actually be financially damaging. And I'd like to give you an example of that using cancer. In this case, cancer is an example of a chronic disease, and I'm going to use it as a surrogate for multiple other potential diseases that a person who sequenced their DNA could uncover. But what we do know from analyzing a variety of different scientific literature is that those who are diagnosed with cancer, oftentimes they face greater likelihood of going bankrupt. And when that occurs, such individuals also have increased likelihood of dying from cancer. In addition to that, persons who are diagnosed with cancer, they often have to borrow money in order to combat the problems, the disease, and also depending on what type of study you look at it, bulk of them will deplete their life savings. And why would that actually lead to your increased likelihood of dying? Well, one of the problems is that your financial difficulties might delay your ability to treat yourself, as well as it can lead to your stress, increased depression, and ultimately that will decrease your quality of life, and that will have negative outcomes on your long-term health. And one of the best way to protect yourself from that is with insurance. And the scientific literature that I analyzed showed that those patients who had adequate financial protection oftentimes benefited from earlier cancer detection, as well as decreased metastasis likelihood and reduced mortality rates.